Hey friends, welcome to Nursing Online Education. In this video, we will be discussing important question and answers of different nursing comparative examinations. Guys, let's get started. Here is our first question.
1. A 68-years-old woman diagnosed with thrombocytopenia due to acute lymphocytic leukemia is admitted to the hospital. The nurse should assign the patient to A. To a private room so she will not infect other patients and healthcare workers. B. To a private room so she will not be infected by other patients and healthcare workers. C. To a semi-private room so she will have stimulation during her hospitalization. D. To a semi-private room so she will have the opportunity to express her feelings about her illness. The answer is option B, to a private room so she will not be infected by other patients and healthcare workers. 2. A nurse who begins to administer medications to a client via a nasogastric feeding tube suspects that the tube has become clogged. The nurse should take which safe action first? Aspirate the tube. B. Flush the tube with warm water. C. Prepare to remove and replace the tube. D. Flush with a carbonated liquid such as cola. The answer is option A, aspirate the tube. 3. Which of the following instructions is appropriate for the nurse to give to a female client who complains of abdominal upset after cholecystectomy operation? Increase fluid intake. B. Avoid fatty meals. C. Increase protein intake. D. Daily exercise. The answer is option B, avoid fatty meals. 4. Which of the following pulses should be checked before administering digoxin? A. Apical pulse. B. Radial pulse. C. Femoral pulse. D. Dorsalis pedis pulse. The answer is option apical pulse. 5. Which of the following interventions must the nurse take when administering digoxin to the patient? Give him the medication with a glass of orange juice. B. Check him for signs of hypokalemia before giving the medication. C. Instruct him to place the medication under the tongue. D. Withhold the medication if his pulse is less than 60 beats/minute. The answer is option D. Withhold the medication if his pulse is less than 60 beats/minute. 6. The nurse must withhold digoxin from a patient if his pulse rate is less than 45/m, B. More than 60/m, C. Less than 60/m, D. More than 100/m. The answer is option C, less than 60/m. 7. The nurse is assessing the client for possible evidence of digitalis toxicity. The nurse acknowledges that which is included in the signs and symptoms for digitalis toxicity: A. Pulse, heart rate of 100 beats/min. B. Pulse of 72 with an irregular rate. C. Pulse greater than 60 beats/min and irregular rate. D. Pulse below 60 beats/min and irregular rate. The answer is option D, pulse below 60 beats/min and irregular rate. 8. A newly admitted client takes digoxin 0.25 mg per day. The nurse knows that the serum therapeutic range for digoxin is A. 0.1 to 1.5 nanograms per milliliter, B. 0.5 to 2.0 nanograms per milliliter, C. 1 to 2.5 nanograms per milliliter, D. 2.0 to 4.0 nanograms per milliliter. The answer is option B, 0.5 to 2.0 nanograms per milliliter. 9. A patient complains of severe pain which he stated to be 9/10. The physician ordered morphine 50 milligrams for every 4 hours. The last dose was given 2 hours ago. What is the best action his caring nurse would take? A. Give another dose of morphine. B. Inform the doctor to change the order. C. Distract the patient by TV, radio, or games for 2 hours. D. Ignore the patient completely. The answer is option B, inform the doctor to change the order. 10. The nurse is caring for a patient admitted 1 week ago with an acute spinal cord injury. Which of the following assessment findings would alert the nurse to the presence of autonomic dysreflexia, hyperreflexia, A. Tachycardia, B. Hypotension, C. Hot, dry skin, D. Throbbing headache? The answer is option D, throbbing headache. 11. Which of the following is the best way for long-term feeding for a patient experiencing severe dysphagia? A. NGT, B. Nasoduodenal tube, C. Gastrostomy, D. Parenteral? The answer is option C, gastrostomy. 12. Patient records are as following. He had 650 cubic centimeters of 4 fluid, N/S, 50 milliliters of orange juice in the NG tube, 100 water with the medications, and urinate 500 cubic centimeters, and 100 cubic centimeters collected in the NG bag. What is the total intake for this patient? A. 800 cubic centimeters, B. 650 cubic centimeters, C. 200 cubic centimeters, D. 600 cubic centimeters. The answer is option A, 800 cubic centimeters. 13. The physician ordered to give the patient 10,000 unit of heparin. The preparation available is 40,000/milliliter. How much would the nurse give this patient? For milliliters, B. 2.5 milliliters, C. 0.25 milliliters, D. 25 milliliters. The answer is option C, 0.25 milliliters. 14. The nurse is caring for a client with a fracture. The client develops a deep vein thrombosis in the opposite extremity. Physician orders include a heparin drip of D5W 250 milliliters with heparin 12,500 units at 16 milliliters per hour. How many units of heparin is this client receiving per hour? 200 units/H, B. 400 units/H, C. 600 units/H, D. 800 units/H. The answer is option D, 800 units/H. 15. A patient suffers from diarrhea and muscle weakness. The nurse would assess this patient for which of the following abnormal laboratory blood tests: blood calcium, B. blood magnesium, C. blood potassium, D. blood sodium. The answer is option C, blood potassium. 16. When assessing for therapeutic effects of mannitol, the nurse would expect to see decreased intracranial pressure, B. decreased excretion of therapeutic medications, C. increased urine osmolality, D. decreased serum osmolality. The answer is option A, decreased intracranial pressure. 17. Which drug would be used to treat a patient who has increased intracranial pressure, ICP, resulting from head trauma after an accident? A. Mannitol, B. atropine sulfate, C. epinephrine hydrochloride, D. sodium bicarbonate. The answer is option A, mannitol. 18. Which of the following is the drug of choice for treatment of cerebral edema? A. mannitol, B. atropine sulfate, C. epinephrine hydrochloride, D. sodium bicarbonate. The answer is option A, mannitol. 19. The nurse would assess which laboratory value to determine the effectiveness of intravenous heparin: complete blood count, CBC, B. activated partial thromboplastin time, APTT, C. prothrombin time, PT, D. BUN. The answer is option B, activated partial thromboplastin time, APTT. 20. The antidote to heparin is A. aspirin, B. vitamin K, C. warfarin, D. protamine sulfate. The answer is option D, protamine sulfate. 21. How do we monitor the effectiveness of Coumadin, warfarin, and monitor vital signs? B. PT/INR, C. Weight, D. Ask the patient how they feel. The answer is option B, PT/INR. 22. Which medication is used to treat a patient suffering from severe adverse effects of a narcotic analgesic? Naloxone, Narcan, B. acetylcysteine, Mucomyst, C. methylprednisolone, Solomedrol, D. protamine sulfate. The answer is option A, naloxone, Narcan. 23. A patient who has been anticoagulated with warfarin, Coumadin, is admitted with gastrointestinal bleeding. The nurse will anticipate administering which substance? A. vitamin E, B. vitamin K, C. protamine sulfate, D. calcium gluconate. The answer is option B, vitamin K. 24. While admitting a patient for treatment of an acetaminophen overdose, The nurse prepares to administer which of the following medications to prevent toxicity: naloxone, Narcan, B. Acetylcysteine, Mucomyst, C. Methylprednisolone, Solomedrol, D. Vitamin K. The answer is option B, acetylcysteine, Mucomyst. 25. If the nurse gave a patient antihypertensive drug that is prescribed for another patient, what should she do? A. Ignore what she has done. B. Call urgent CPR. C. Document that in nursing report. D. Inform doctor after 2 days. The answer is option C, document that in nursing report. 26. When a physician orders an arterial blood gas, which artery is the appropriate one to use to obtain the specimen? Cerebral artery, B. Radial artery, C. Carotid artery, D. Ulnar artery. The answer is option B, radial artery. 27. A diabetic patient with foot gangrene undergone above knee amputation. He complain of pain and swelling at the wound site which is oozing pus and has a bad odor. The physician ordered cephalexin and metronidazole. Which of the following you should do immediately? A. Give cephalexin direct first action. B. Give metronidazole direct first action. C. Do wash on wound with N/sand put bacitracin. D. Do wash on wound with N/sand put hydrocortisone. The answer is option C. Do wash on wound with N/sand put bacitracin. 28. The physician has prescribed a cleansing enema to a client scheduled for colon surgery. The nurse would place the client A. Prone, B. Supine, C. Left sims, left lateral, D. Dorsal recumbent. The answer is option C. Left sims, left lateral. 29. At which side of the patient will the nurse stand when inserting a rectal enema? A. Right side, B. Left side, C. Any side, D. Both sides. The answer is option A, right side. 30. While undergoing a soap suds enema, the client complains of abdominal cramping. The nurse should immediately stop the infusion. B. Lower the height of the enema container. C. Advance the enema tubing 2 to 3 inches. D. Clamp the tubing. The answer is option B, lower the height of the enema container. 31. The nurse must administer an enema to an adult patient with constipation. Which of the following would be a safe and effective distance for the nurse to insert the tubing into the patient's rectum? A. 1:2 cm, B. 3:4 cm, C. 5.5:6.5 cm, D. 6.5:8 cm. The answer is option D, 6.5:8 cm. 32. The nurse is caring for a patient receiving 4-furosemide, Lasix, 40 mg and enalapril, Vasotec, 5 mg PO bid for ADHF with severe orthopnea. When evaluating the patient response to the medications, the best indicator that the treatment has been effective is A. Weight loss of 2 pounds overnight. B. Improvement in hourly urinary output. C. Reduction in systolic BP. D. Decreased dyspnea with the head of the bed at 30 degrees. The answer is option D. Decreased dyspnea with the head of the bed at 30 degrees. 33. The nurse in preparing to insert RYLE's tube, NGT, into an infant, the nurse knows that the length of the tube should be taken as following: from the nose down to the chin and then to the umbilicus. B. From the nose to the earlobe and then to the xiphoid process. C. From the nose to the mouth to the xiphoid process. D. From the nose to the earlobe to the umbilicus. The answer is option B. From the nose to the earlobe and then to the xiphoid process. 34. The nurse is caring for a client who has had a chest tube inserted and connected to water seal drainage. The nurse determines the drainage system is functioning correctly when which of the following is observed: continuous bubbling in the water seal chamber. B. Fluctuation in the water seal chamber. C. Suction tubing attached to a wall unit. D. Vesicular breath sounds throughout the lung fields. The answer is option B. Fluctuation in the water seal chamber. 35. The nurse is caring for a client who has just had a chest tube attached to a water seal drainage system. To ensure that the system is functioning effectively, the nurse should A. Observe for intermittent bubbling in the water seal chamber. B. Flush the chest tubes with 30 to 60 milliliters of NSS every 4 to 6 hours. C. Maintain the client in an extreme lateral position. D. Strip the chest tubes in the direction of the client. The answer is option A. Observe for intermittent bubbling in the water seal chamber. 36. The nurse enters the room of a client who has a chest tube attached to a water seal drainage system and notices the chest tube is dislodged from the chest. The most appropriate nursing intervention is to A. Notify the physician. B. Insert a new chest tube. C. Cover the insertion site with petroleum gauze. D. Instruct the client to breathe deeply until help arrives. The answer is option C. Cover the insertion site with petroleum gauze. 37. Which type of isolation category is indicated for patient with tuberculosis? A. Airborne isolation. C. Reverse isolation. B. Strict isolation. D. Contact isolation. The answer is option A. Airborne isolation. 38. Which of the following is the best method to decrease confusion and irritability for asthmatic patient? A. Give antibiotic. B. Give sedative. C. Give vasodilator. D. Give oxygen. The answer is option D. Give oxygen. 39. Which one of the baseline vital signs that has the most effect on SpO2? A. Heart rate. B. Respiratory rate. C. Blood pressure. D. Temperature. The answer is option B, respiratory rate. 40. A patient is admitted to the emergency department with a stab wound to the right chest. Air can be heard entering his chest with each inspiration. To decrease the possibility of a tension pneumothorax in the patient, the nurse should position the patient so that the right chest is dependent. B. Administer high-flow oxygen using a non-rebreathing mask. C. Cover the sucking chest wound with an occlusive dressing. D. Tape a non-porous dressing on 3 sides over the chest wound. The answer is option D. Tape a non-porous dressing on 3 sides over the chest wound.
Thank you for watching.